Creating a gender-inclusive environment in any healthcare setting can benefit all patients and lead to improved health outcomes and a better overall experience for everyone. Despite a growing awareness in the medical community about the gender spectrum, some healthcare providers still say that they feel a sense of awkwardness when interacting with transgender patients because they don't feel equipped with the right language or enough background knowledge around gender identity. All too often, this can translate into an inferior quality of care and a negative overall experience for both the transgender patient and the healthcare provider. Creating an affirming care environment often begins even before the patient comes into contact with the healthcare provider. Identifying and training exceptional staff members who can effectively communicate respect for all patients, regardless of their gender identity, is a key component of a welcoming, gender-expansive clinic environment. If the staff members themselves can be representative of the diversity that the clinic wishes to welcome, that's even better. There are also important strategies for making the waiting area welcoming to a diverse patient population.
I think you can make your office more welcoming by some of the literature you have, having a gender-neutral bathroom, so not necessarily women's versus men's, gender-neutral people bathroom. Making sure that when the staff call the person in, that they're actually using their preferred names. The next thing I would say is preferred pronouns. So referring to somebody in the pronoun that they're comfortable being referred to. And so, if somebody wants to be called he, then you just have to ask them. I mean, the basic things you say to somebody, what pronouns do you prefer, if you don't really know?
Like most human beings, healthcare providers might make mistakes occasionally and use language that doesn't affirm the gender identity of a patient. Acknowledging the mistake and moving on emphasizes to the patient that the healthcare provider is genuinely trying to create a supportive, inclusive environment. Many healthcare providers also emphasize transparency as an important part of establishing a trusting relationship between themselves and their patients. For example, when a physician explains to a patient why they need to know certain information or why they may be ordering a given test, this strengthens the doctor-patient relationship. Finally, attention still needs to be given to providing high-quality, precision care that supports the health needs of the whole patient, in addition to their transgender health-related needs.
The other thing is just asking what else you can do to support them, because just assuming that there may be some discomfort or anything that they might be struggling with, and they might not be, they may be perfectly fine, but there's no harm in asking somebody, is there anything I can do to support you, or is there anything else you need?
I think that the number one issue in primary care today is the difficulty in accepting that there is no harm in treating. It's very easy to learn the medicine, and the barrier to care is people's concept that somehow doing nothing is better medicine, when the evidence, 40 years of evidence, is the contrary, that we can save lives, that this group of people has one of the largest health disparities in the nation today. We know this is a population we need to serve and can serve, and it starts with children. It starts with children.